Uterine fibroids are a medical condition that affects many women. Sponsoring our segment this afternoon is Carle, and with us is Dr. Yusuf Elias. Welcome, doctor.
Thank you for having me.
Now, you are a bit of an expert in this area when it comes to uterine fibroids. For those of us that don't know, what is that?
Sure. Uterine fibroids are basically considered a benign, disorganized growth of uterine tissue. It's benign, meaning it's not malignant. It does not spread outside of the uterus, stays within the uterus. The medical term for fibroids is leiomyomas, or for short, myomas. It's a relatively common condition in women who are childbearing age or premenopause. It occurs about 40 to 80% of women.
Oh, wow. How big are these fibroids? Are they large or
Sure.
fairly small?
So they can range in size from anywhere from 1 centimeter to several centimeters. They could reach like a softball size even. The reason I mentioned 1 centimeter is because the lower detection threshold for a lot of the imaging is about 1 centimeter. But as you can imagine, they start very small, but they could reach several centimeters in size and in diameter. And there could be several of them in one uterus.
So I guess that begs the question, how would somebody know if they have uterine fibroids?
Very good question. So a lot of women, as we had just mentioned, about 40 to 80% of women can have fibroids, but a lot of women do not even know that they have fibroids because it's asymptomatic. They're without symptoms. But once the fibroids reach a certain size or number, then they can become symptomatic. Some of the symptoms that women can experience, they're basically categorized in 2 categories. One is bulk symptoms, which is basically causes pelvic pressure or pain. It could start pressing on the bladder, causing increased urinary frequency. It could even cause a little bit of incontinence. It could also cause bloating or constipation. The other category of symptoms is bleeding. Some women will experience a lot of heavy menstrual bleeding, prolonged menstrual periods lasting longer than 7 days. There could even be some bleeding in between periods. So some of these symptoms, when they occur, patients start to get worked up for fibroids.
Okay, and then what actually causes them, and which women are more susceptible than others?
Very good question again. Fibroids, unfortunately, we don't know exactly what causes them. It's probably a combination of genetic factors and environmental factors, but today it's not clearly understood what causes them. In terms of who's susceptible, there are some risk factors. We do tend to see them. They occur more in African American and Hispanic women. They occur more frequently. Certain diets are associated with increased number of fibroids. Diets high in meats, low in green vegetables and fruits and dairy. There seems to be an association with alcohol consumption as well. And of course, like we mentioned, a genetic factor. So if a patient's mother or sister has fibroids, that patient may also have fibroids.
Now, you're a specialist in this area, so I am curious, what tests are used to determine if fibroids are present in the uterus, and what does treatment look like?
Sure. The most common way to detect fibroids is going to be with some sort of imaging modality. Most commonly, it's going to be a pelvic ultrasound. So if there's suspicion that there are fibroids, the patient will have a pelvic ultrasound to detect the fibroids. But there are other types of imaging modalities. MRI, for example, magnetic resonance imaging, can detect fibroids very specifically. A gynecologist can actually directly visualize a fibroid if they're looking with a speculum exam and directly visualize it on the inside of the uterus if there are fibers on the inside, something called hysteroscopy. It can even be detected by direct visualization on the outside of the uterus through some surgical procedure called laparoscopy. So many ways of detecting fibroids. Most commonly is going to be an ultrasound.
Okay. And then I'm sure treatment is something that you deal with all the time.
This is what we deal with the most, is the treatment aspect. So there are many treatments to fibroids, depends on the symptoms, the number of fibroids, and the size of the fibroids. There are surgical options where the uterus is completely removed, something called hysterectomy. There's surgical options where you could actually remove 1 or 2 fibroids. Our specialty, we do something very minimally invasive called uterine fibroid embolization. So for women who are of childbearing age or who want to have children, want to keep their uterus intact, what we do is we go inside the arteries and we block the blood flow to the arteries. This way it shrinks the fibroids, maybe even resolves them.
Wow, that is absolutely fascinating. We really appreciate you being here, Doctor, just to kind of share all of this information. And if you are interested in getting more information, we're going to connect you with Carle, who we appreciate sponsoring our segment today over at ciLiving.tv.